So the agenda for today is we're going to cover the goals of the webinar, brief introductions. We will go through why the ACS ID and the American Board of Surgery ID are important as it relates to credit claiming. We're going to cover new content on the CME accreditation platform, a few ACCME hot topics, followed by general reminders and updates, and then we'll get to our Q&A session. So the goals of today's webinar are to learn the importance of collecting the ACS ID and ABS ID as it relates to claiming credit, to discuss the application timeline and the new content inside, and to review the new ACCME activities and highlights. Okay, I'd like to take a moment to introduce our CPDA staff. We have two members today, two new members, Jane Basowitz, who's our new senior manager here at CPDA, and Marilyn Render, who is our new senior administrator here in CPDA. And I would like to take a moment to reintroduce you to Tony Avery. Tony Avery is our team lead on MyCME. She's a point person on medical state board reporting and on CME transfers. So any questions you have regarding those topics, Tony can help you with. Again, my name is Jada Higgs. I'm one of the administrators here in CPDA. We are all here to help you get your activity accredited and make the process as smooth as possible throughout the application cycle. Okay, I'm going to now turn it over to Tony, who is going to cover ACS IDs and ABS IDs.
Hi, thank you, Jada. Good afternoon, everyone. Today, we're going to talk about what's old is new. So the importance of collecting ACS ID numbers along with the ABS ID for your activity. For attendees who have their transcripts here at the ACS, it's important to collect the ACS ID number along with the ABS ID number, simply because without the ACS ID, we are unable to, when you submit your attendance sheets, we're unable to upload their CME data into their account because we don't have that information. And unfortunately, without the ABS ID number, we are not able to transfer their CME records over to the ABS, and it's just not seamless. So we encourage, when you are uploading your information or getting your data, to have those attendees make sure that they fill out that information in order to have their information recorded here at the ACS. And sometimes we have medical professionals who will sometimes call us because they don't see their CME data, and it's because they've not submitted that information, or they may have submitted incorrect numbers. So we ask that you get that data from them when you are submitting your attendance sheets. I'm sorry. Next slide, please. Now you may ask, well, how do you get this information? So you'll ask that attendee for your accredited activity at the time of registration, or you can get it at the time of the session evaluation. And again, it's important that we have that so that the attendance sheet is uploaded without any hiccups, and that participant of that activity gets their CME data in a timely fashion. Now, we're excited to announce that coming in 2025, we will be doing automatic transfers. Now, currently, the learner will transfer CME credits over to the board themselves. They initiate the process, but in the future, if the learner would like their information to be transmitted to the ABS, they will need to be certain to have provided the ABS ID number, the ACS ID number, and they opt into the feature. Some have the option to opt out. They may want to continue initiating the process themselves, but this is something that is coming very early in 2025. So we're excited about it. Stay tuned. We will let everyone know by email. There will be something posted on our website to let people know that this feature is now available. And now I turn it back over to Jada, who will talk about state requirements.
Okay. I would like to point out in the CME statement that is submitted to you in the program requirements document, I know you're familiar with the program requirements document. It is sent to you when your certificates are distributed at the pre-approval stage. And it is basically just a guideline of what is required to go in your program materials for your learner to see. This slide is all about pointing out the CME statement on the program requirements document. It is required to be displayed exactly as it is here. There's no particular place that we require it is located. It is just your learners need to be able to read these lines verbatim. It can go on your product page. It can go on your program guide. It's not required before the sessions far in advance like the disclosures are. We do want to review it, the 15 days out when we get your program requirements, but it is often overlooked, and we just wanted to bring that to your attention to please include that in your program. Also, we want to talk briefly about the disclosure table, the new disclosure table that is in the program requirement document. We do have a new format, and this request was made by the ACCME. So it may look a little different, the layout of this table. Please ensure that the information is noted and posted on your website again or on your program materials for all learners to see any potential conflicts that the speakers may have. But please let us know if you have any questions there. And then we want to briefly talk about the attendance sheets. This slide is a reminder about the attendance list. As you all know, the attendance list does verify the learner's participation in the CME activity. For live activities, credit claiming closes no later than 60 days post-event. We do ask that you upload the first attendance list 31 days post-event. The second upload is for people that may not have been captured on the first upload. That's for live activities. And we do ask that for enduring activities, the credit is claimed when the activity ends. So it's not an additional claiming period for that. So we will ask that you upload the attendance monthly for enduring events. All this is in accordance with the ACCME guidelines for reporting learner data that is required. And now I'm going to turn it over to Jane to cover new content on the CME accreditation platform.
Thank you, Jada. So what we have here is our joint providership timeline, and a material on our website changes, and I'm going to be reviewing some as new content and some as some materials that have changed. And while we have these webinars to inform you and we send out emails, it is important to always check the website when you're working on your application. And I want to keep in mind, that it's about 3 months to process an application. And please note that the final program materials are due no later than 15 days in advance of the activity. That gives us time to review everything. If there needs to be any changes, we can reach out to you and those can be addressed. And this information is posted on the website, and please review as you're planning your CME activity. So this slide outlines the post-activity reports timeline, the post-activity timeline. And what is here, and that what I want to emphasize, is that it's important not to wait to the last minute to do this. And also to please keep a record of all slides, as we may request these slides to review for a presentation that have a direct conflict noticed. And also you will see on the other slides that we ask that everybody keep all their materials for 6 years as required. So reporting PARS data. Activities for reporting PARS data. This is to give you a screenshot of the PARS data and how it looks when you're entering it. And it's important to keep in mind, and it's on the website, that activities active between January 1st, 2024 through September 1st, 2024 should upload this information no later than December 31st, 2024. Any activities that are launched between September 2nd through December 31st should be turned in no later than January 15th. And PARS data, as you can see on the screen, include the total number of learners, by MD-DO learners and by non-MD learners. And also examples of financial, and it's listed on here as well, include any revenue, commercial support, and also another example is monetary income from exhibits. So this shows the reporting evaluation data. And this is important deadlines. Again, the session evaluation data is due at the time of the final attendance list submission. And post-activity, the final attendance list and post-activity is due 90 days at the close of the activity. There are some items that you might have prior to the 90 days that are final that you can certainly feel free to submit now. Not now, but during your CME activity. Okay. What's new on the application? So I'm not going to go through every step of this slide, but I'd like to bring your attention to the planning committee disclosures. And you're going to hear me say this a couple times in different ways, that all planning committee disclosure forms need to be turned in prior to planning the activity. And that includes anyone involved with planning the content, including any staff that's working on it as well. And it includes anybody who is planning the content and has any type of input. Next slide. So what's new on the application? The second slide is about speaker, faculty, moderators, and contact reviewers. And again, all speakers need disclosure forms. Again, anyone who contributes to the content. But we have something a little new that is going to really help folks is you can include everybody on your disclosure summary. You hang on to the disclosures. You do not have to turn them in individually, and then you can submit a disclosure summary. And also, while you're submitting the planning committee disclosures, you feel free, if you have faculty disclosures, to add that on there, and then you can continue to add on there. You do not have to wait. And we thought that would help folks a lot. And again, the reminder to submit as soon as possible, but no later than 15 days prior to the activity. Now I'm going to turn it over to Marilyn, who is going to talk to you about ACCME Hot Topics.
Thank you, Jane. I wanted to bring to your attention some of the hot topics, pardon me, in compliance check with Dion Riccelli, who is the ACCME's Vice President of Accreditation and Recognition. Next, please. Some of the tips to make you very much aware of is the reaccreditation for the ACS is quickly approaching. Is coming up within. It's really less than 2 years. So it is very important that you understand we must remain in compliance for the purpose of the college and our surgeons, that we meet these accreditation demands and tips. So as shown here on the slide, you will see one of the tips where we talk about non-clinical education and standard 3. Understanding there are some exceptions to the rule, and it will help to ease your administrative burden when you're dealing with these particular applications. So with non-clinical education, you do not need to identify, mitigate, or disclose financial relationships. So we wanted to make that very clear to the program representatives that these accreditation tips are very important, but we wanted to make sure you're in compliance. As shown on this slide, we talk about the mitigating process, because mitigating is relevant when your speaker or related party has some type of financial relationship for the CME planners. So again, when it comes to mitigating these financial relationships, you are required, we cannot stress that enough, to use a different approach with these planners, because this information is important and you must collect it from your authors and your speakers. I know a lot of times they don't want to get this right away, but it is very important. If you're looking for CME accreditation, this must be mitigated, and it is important to have it with your application for us. We introduced this to let you know that there's certain things and updates for the accreditation tips, and we want to make sure you as the planner and us as the entity that's helping with those programs, we want to make sure everyone is in compliance. Another fun tip is if you want to find out some of the more resources that are offered by the ACCME, these are just for you. So when you get a moment, just log on to the website. Coffee with Graham is a very useful podcast that talks about ACCME features and conversations and topics, and it's very, very good for those who are planning health-related meetings. And there's a calendar of events that's offered on the website for ACCME. So again, there are various resources that are available to you to use. And now I'm going to turn it back over to Jada, who's going to give you some general reminders and updates. Jada?
Thank you, Marilyn. A few quick reminders that I wanted to cover today. Please be sure to always download your activity template from your actual CPDA application that you're working in. This ensures you have the most recent template available. We do respond to your feedback and try to make updates and make things as user-friendly and seamless as possible. So a lot of times we may have an iteration on the platform that we want you to use the current format versus what you may have had, saved on in your documents or whatnot, but please ensure to use the current format for the current activity from the platform. Also, please note that obtaining your certificate does not indicate that your activity is fully approved. We would need you to submit every required document down to the credit claiming site and things of that nature, all the final program documents. At that point, your application is then approved and your CME is accredited. We would need to confirm everything that the learner sees before approval. But if you have any questions, again, please don't hesitate to ask us or to visit the CME Accreditation Frequently Asked Questions link. And so now this brings us to the question segment of our webinar. I see we do have there was one question in the chat. I guess.
Yes.
Oh, okay.
So we have a question from Scott, and I'm going to direct this to Sherry to answer. But the question was, does the ACS number apply to physicians who are not ACS or ABS? Emergency medicine, for example, same question for nurses or other healthcare providers who attend our sessions. Or do we just issue them certificates upon request so that they can receive appropriate credit with their, so that they can receive appropriate credit with their licensing body? Sherry, did you want to address that, please?
Absolutely. And I also went ahead and put it in the chat. You guys caught me as I was typing it out. So Scott, to answer your question, we're collecting an ACS ID for any physician who is also a diplomate of the American Board of Surgery. This, regardless of membership. So if you're a member of ACS or not a member of ACS, if you are looking to have your data transmitted to the American Board of Surgery, then you will want to ensure that your learner has an ACS ID. So a few slides back, when we talked about language that you're going to put on your program requirements, under the program requirement document, we mention in those 3 statements that we'd like you to post, the directions for non-ACS members to create an ID on our website to ensure that their CME credit is tracked within our system. So for 2 reasons. One, if they want to log in and transmit their data themselves to the ABS between now and when we launch our auto send, they'll be able to do so. And then 2, once we begin that auto send process, without that information, learner data will not automatically flow once your learners have claimed that credit. So in summary, it's physicians only. It's regardless as to whether or not you are a member. If you are a member, jot down your number, let them jot down the number. If they are not a member, encourage them to create a member profile on our website following those directions so that, and then provide you that number so that when they claim that credit, it does show up on a transcript. So they have the ability to transfer that data to the ABS. Now, the other specialty boards that are collaborating with ACCME, we will in future, not now, but in future, we will be also automatically sending CME data to those other specialty boards as long as A, you have indicated this request on your application, the certifying board, and B, that you're meeting the requirements or your activity is meeting the requirements that that certifying board has in order to deem your activity as qualifying for the specialty board. Those directions, when we move forward, would be on your application. Obviously not there now, we're not live yet, but in future, we will be looking to do that. Does that answer your question? We do a monthly lecture for RSS. Sometimes speakers get switched up or not confirmed until last minute. How flexible are you with the 2-week submission requirements? We take bribes, Scott. We take donuts. We take coffee. We understand that there's changes. We completely understand that. So the sooner the better you get it in. And one of the reasons we ask for it to be as far in advance as possible is primarily because if there is something that your chair needs to mitigate, I think we've all ran our activities in past and we know what it's like to try to get in touch with one of your volunteer members. It can be a little bit challenging. So we just want to make sure that you have enough time to mitigate any of those conflicts. If we do not have that disclosure prior to that activity going live, that particular section of the session cannot be CME qualified. We have to have all of those in place in order to actually award that CME credit. Any other questions?
Okay. No more questions. Then,
Jada, if I can,
sure.
just one more quick thing, I'm sorry. So something else to know about, not know about, just to refresh, one of the things that we had mentioned earlier in the webinar, we talk a lot about your final activity. So you have that session evaluation that Jane went over that takes place after your learner goes and they attend the event, right? So they go in, they fill out their application or their session evaluation, and they will use this and sometimes the self-assessment to claim their credit. Then we have that post-activity survey that is launched out 60 days after the event, and then day 60 to 90, we ask that once you get the survey results from your learners that you return those post-activity surveys to us. In the past, and I know we kind of explained it, but I just want to reiterate one more time. In the past, you had that full 90 days to collect all of that PARS data information. So reporting to us your total learners for MDs and non-MDs, and then all of those financials that are tied into it. You were always in past able to do it when you just did your post-activity survey. Just a refresh, we're asking for that PARS information sooner. So we're asking for those total MD, non-MD learners and any revenue collected on day 61, if it's a live event, on day 61 when you report your attendance, or if it's an enduring activity, once that enduring activity ends. And again, that should be within the 30 days. And then just to reiterate, and if I'm getting too far ahead, you guys can stop me, but just to reiterate, the purpose of providing us your attendance list 30 days after the activity is now with this auto send process in ACCME, we as a CME provider are required to report those learners over to ACCME and the ABS. So that's why you might all of a sudden start getting email alerts from us saying, hey, where's your attendance list? It's because we're being required by ACCME to report sooner than later. So I just wanted to refresh everyone. There will be an email going out later this week that will remind you, as Jane had already said, obviously this is my wheelhouse, so I'm overstressing it, but any activities that were active during that January 1 and that September 1 date, all of your PARS data information, we're not worried about that post-activity survey, but all that PARS data information has to be in the system by December 31st. And those activities, September 2nd to December 31st, that information needs to be reported by January 15th. So thanks so much for letting me repeat myself on that.
Thank you, Sherry. We know how critical that piece of data is for our annual reporting. So we want to thank everyone for joining. Are there any other questions at this time? I just want to confirm we're running a little ahead, so we can give you some time back, but we want to make sure that, we've covered everything that may possibly come up. Okay, well, please expect to receive a copy of today's presentation, slides, and the recording shortly. You know where to find us. We can be reached at mycme@facs.org or at cpda@facs.org. We're all here to help you. Please don't hesitate to reach out with any questions you have, no matter how small they are. I guess that's all we have. Have a great afternoon, everyone. Thank you for your time. And we look forward to providing you with a copy and the next webinar in January.